Welcome to Chapter 11 of the High Definition Body Sculpting, which is also Episode 11 of the Lymphatic Massage Therapists Book Club. So we're looking at Chapter 11, which is into male liposuction, specifically the male torso and back. And the interesting things in this chapter were actually right in the beginning and right in the end. So they start talking about drains, and just like the other chapters, they'll tell you where the incisions are placed. But they talk about the use of drains, and they want to put a drain in the posterior torso in the intergluteal incision point, and it's in the back, the low back. So this is the interesting part. Closed drains are more bulky and difficult to conceal, the authors say. They tend to be more cumbersome with the foam vest and garment and the drain for the client in the postoperative, the first days and weeks. But, and I'd never heard this before in any other text, which is why I'm just really, really happy that I'm reading this. The vacuum generated by the drain may improve skin redraping. And I never thought of this before, but we do know that using drains in some types of plastic and reconstructive surgery reduces the incidence of seroma. But I'm really, really interested in the theory that having that constant vacuum is going to help the skin redrape better versus having the swelling there and the regular pressure inside the body of the skin. So very interesting to me, and I'm really gonna have to put that if I have a conversation with the client of whether they should have drains or not. Mostly what I've been hearing, what I've been seeing online on the Facebook groups is people really don't like drains. They don't understand drains. They want drainless operations. But this is one really interesting reason as to why it might be positive to have a drain. Okay, so then right to the end of the chapter, page 136, postoperative care. Padding is placed over the sacral triangle for extra compression, and they do use a high definition foam vest and overlying compression garment. So that is really helpful, and I think that's kind of an afterthought for some clients after plastic surgery. If they're doing the Lipo 360, it involves the back, but I find that people really focus more on the front of the body, getting the foams in correctly, and the flanks to help, make it a little more comfortable. And sometimes the back is an afterthought. I know we have a lumbar board, which is very uncomfortable for some clients, but they're really not maybe as focused as they could be on putting compression into the back. And then I really like this idea of even over the foam vest and overlying compression garment, also padding over the sacral triangle for extra compression. So that is chapter 11 of this wonderful book, and I will see you in a future episode.